Good afternoon, everyone, and welcome to the third of our 4 Women's Month special programs. My name is Thandi Balfour. I'm your host for this afternoon. And today we're looking at everything women's health. Well, as much of it as we can cover in 90 minutes. A reminder to everyone that we are live, so please feel free to send in your questions and your comments as we go along. Today we've got 2 specialists who are going to be helping us to understand the woman's body further. And I think the basis for our talk really is based on Psalms 139, where we are reminded about how fearfully and wonderfully we are made, and that God knit us together in our mother's womb. So everything about the human body, everything about the woman's body is deliberate and by choice and serves a special function. And God put it that way because it best served his purpose. So we want to unpack that and say, what does that look like? And what is it that makes us really so special and so fearfully and wonderfully made? So I've got 2 guests. I've got a gynecologist and I've got a physiotherapist, and I'm looking forward to the conversation that we're going to have. So let's start with you, Sis Tanya. Welcome to our session this afternoon. Please tell us a bit about, what it is that you do, what's a gynae, and what's your typical day like?
Good afternoon, everyone. So what does a gynecologist do? First of all, we're not only gynecologists, we're also obstetricians. And the gynecologist basically deals with the unpregnant woman or with early pregnancies. And an obstetrician is the doctor who takes care of the pregnancy when it's advanced and helps with the delivery of that baby, and then takes care of the mother after she's delivered for the first 6 weeks after she's delivered. So a typical day, you see a range of women, mostly from the age of 18 upwards. Most of the presentations would be discharges, so vaginal discharge, abdominal pain, menstrual problems, counseling on contraception, and then there'll be the pregnant women who come in for their antenatal care.
Okay, so it's a spectrum from pre-pregnancy all the way up to the first 6 weeks, you said, of pregnancy. Okay, interesting. So we'll come back to you. Sorry, it's Tiny Baba, by the way, Dr. Tiny Baba. And then on our virtual studio, because we all cool like that, we've got our physiotherapist. So welcome, Dandile. Can you also just do the same? Tell us a bit about what is physiotherapy and what's your typical day like? Can we just sort out the sound there, because I think we've lost sound.
Sorry, I had muted myself. Sorry.
Okay. Thank you. We can hear you
now. I'm unmuted now. Oh, this thing. Good afternoon once again, and happy Sabbath to everyone. I am a physiotherapist and I work in private practice currently. In a psychiatric clinic. I do in the past 3 years, previously to 3 years that I've been in the psychiatric clinic, I was working in a gynae and an obstetric unit. So with the time, we will be able to coordinate some stuff there. My tip, physiotherapy, it is a healthcare professional, a profession that is concerned with human function and movement and to maximize physical potential. So it would therefore mean that anything moving, if you are immobile, we are there to move you. If your function has deteriorated, we're there to improve the function. And my typical day, it is to deal, because I'm in a psychiatric unit now, I deal with people that have got musculoskeletal problems, meaning that they've got headaches, they've got back pain, they've got neck pain, they've got shoulder pain, they've got leg pain, all sorts of pains in the body, and stiffness of joints because they would have had an operation and they find themselves in hospital, or they would have fallen, they've got bad posture, and that would be my typical day. But in the other life, when I still worked in a hospital, in a gynecology, in an obstetric unit, I treated the mothers that would have delivered, and because of delivery, when if you've delivered via operation or cesarean section, as it is known, somebody wakes up and they don't know what to do with themselves. They don't know whether to stand up, how to stand up, how to move, how to cough, how to breathe, because suddenly they can't cough. When cough, it causes pain. So we actually then start them from teaching breathing exercises, how to cough, how to get out of bed, how to sit out of bed, and how to walk again, because they would have been numb from the anesthetic. That you're lying in bed and you're numb, you don't know that your legs are going to walk again. So you need somebody to guide you through that process. And then it spans through to those that have done total abdominal hysterectomy in the latter stages of one's life, depending what would be the cause of that. Tiny can talk to that. And we come in to say you've had your hysterectomy, your womb removed, then you don't know what to do with yourself, or what exercises you must do to maintain yourself. Women's health and incontinence, that those people after normal vaginal delivery or for some other reasons, they find that you cannot control urine. It's common in some women that the bladder gets loose. By the time you get to the toilet, you started dripping, and we teach them exercises to control the muscle. Let me stop there for now.
Well, it sounds like as a physiotherapist, you need to know everything about the anatomy, really, because you've mentioned everything from head to toe, from what I'm hearing.
Yes.
And as you were talking about coughing there after birth, so I did it the natural way, and I still couldn't cough. It was so sore. Every time I tried to cough, I had to think about it. So sneezing was the worst, because that you can't control. Okay, so do I need physio? Is physio work remedial? So do I need to see a physio because something has gone wrong, or could I just visit a physio, I don't know, preventatively, if there is such a thing?
Definitely yes. We encourage health promotion, that you come and see a physio as a prevention measure, because of the nature of the human body. We do not understand. You correctly said that we are fearfully and wonderfully made by God. We think that we are doing things normally, only to find that it's so abnormal. It is not correct. And these days, people sit on the couch and they slouch and they find that they've got back pain. Our kids, they carry huge books to school, and that causes back pain, early back pain. And parents just dismiss it that you are too young to have back pain, so it cannot be. So the question is, correctly, yes, you can see a physiotherapist, so that we can just assess and actually see if there is anything that you can be able to maintain and prevent it from further being complicated. Like as you were talking, when you were talking about normal delivery, vaginal delivery, we still get called to do exercises for people, because when you are going to deliver, you have your legs wide open. And I had a 19-year-old girl who couldn't close her legs. She was sitting there, lying in bed like a starfish, and could not close her legs. And she did not know how to get out of bed. They didn't do anything. She was in so much pain. So they actually had to call me to come and assist to get her to close her legs and to be able to walk out of bed again. So it does okay. Thank you.
Sure. Okay. That's gone very deep very quickly. I want to bring in Tiny as well. Tiny, let's talk about the gynae visit. So not the pregnancy-related one. How soon can one send their daughters to go visit a gynae? Is there such a thing as too early to start seeing a gynae as a young girl?
So the quick answer is no, it's never too early to send your daughter to see a gynae. Because one of the services or one of the duties that we're meant to fulfill is to teach young girls about their body. So you don't necessarily have to take them to a gynecologist, but you can take them to a general practitioner. So in the young girl, the education would be around her own body, what to expect with when her periods start. So what to expect in terms of, well, the blood, number one. 2, what it means when she starts menstruating. And then the added things to menstruation, so the cravings, the pain, the skin changes, what's going to happen to her hair, both the good and the bad. So some people get their hair falling out or becoming too oily and becoming thin once they get to adolescence, and that's just because of the hormones. It will come back. And then the skin changes. So it is about education. Then also, it's an opportunity to talk to young girls and their parents about vaccines or immunization, which for the gynecologist perspective, it would be the HPV vaccine. It also gives you an opportunity to talk about contraception. Not only do we use contraception in the young girl for family planning, in fact, in the young girls who are not sexually active, we often use contraceptives not for family planning, but for the skin problems that come with adolescents. And then the girls that really have bad acne, they may be on the vitamin A treatment. Roaccutane, thank you. And when they are on Roaccutane, they need to be on reliable contraception. So you may find that a young girl has been to see a dermatologist or even a GP, and she's had Roaccutane recommended or prescribed for her. And then they'll say, please go and see someone for contraception. So it is an opportunity to then talk to her about what her contraceptive methods are, because there's quite a lot of things that young girls can choose from. And
can I just to come in there? So there's this perception amongst us lay people that contraceptions are not good for you, and so the later you delay starting using them, the better it is for your system. And now you're talking about young girls who would then start using them, yes, for non-sexual related situations. Is that not unhealthy for young girls who are still developing?
So all medication has got its pros and cons, right? So, and this is why I say you sit down and you have a discussion with the parents and the young girl. And you allow the parents and the child to then decide what is best for the young girl. And remember, you don't give contraceptives to any young girl. You give it to someone who needs it. So someone with really bad acne, that it's affecting their self-esteem. Someone with menstrual problems. Menstrual problems can be the abnormal bleeding, or it can be severe pain that has no underlying cause. You can use contraceptives for that. So you're not going to give it to just anyone. It's going to be for a specific young lady, for a specific cause, for a specific amount of time. And then as a doctor, you then review and then decide whether you need to carry on with it or not. Because the reality is no one sticks to contraceptives for a long time anyway. And young girls have got a more vibrant social life. They don't really want this thing called a pill impeding their social life. So the fact that they have to remember it every day is usually an impedance for them to carry on with the contraceptives. So it's usually for a certain amount of time and for a certain cause. We don't just give it to everyone.
And what makes for a normal discharge in a young girl who's not yet sexually active?
So all women have a discharge. So there are secretions that are created by the vagina naturally every day, right? And it changes with your cycle. It changes color, it changes consistency, and if you're one of those people that want to smell it, the smell changes as well. And it's influenced by the change in hormones in the woman's body. But some discharges are not normal. So how are you going to know if it's abnormal? If there's pain associated with it, if there's a bad odor, if there's pain, if there's bleeding associated with it. So those are the 4 key things that you're gonna, if you see a discharge, it needs to go through your head. Am I in pain? Was there bleeding immediately before this? And is it itchy? Or is there pain underneath there? Or is there burning when you pass urine? And if those things are not there, then it's probably a change in your hormones and in your cycle that's causing that discharge.
And the color of the discharge as well? Is that
the color, I mean, every woman knows what colors they go through. So anything that is out of the normal is going to be a sign that something isn't right.
Yeah.
But when you're not sure, go see a doctor.
Okay. Because I think a lot of times, especially if this conversation is not happening with young girls, by the time that starts, they become scared to ask and they blame themselves, and then they think they're going to get into trouble for asking such questions. Because, like, why are you having discharges when you must be doing something?
Can I just share an experience about that? So we often see young girls who come in with what we call thrush, right? And they're petrified. They're not sexually active, and they are scared. So first of all, they haven't told their parents that they're here. They've stolen the medical aid card. And they're convinced it's a sexually transmitted infection, but they're not sexually active, so they don't know how they got it. But they've heard myths that people fall pregnant without having sex, and people have gotten STIs from toilet seats. So it's for me as an adult, it's amusing, but for them, these kids are, I cannot describe that amount of fear.
No,
they are
can I tell you, that was my first quote-unquote gynae visit. I hadn't started my period, and this is now overshare. But I had this, I think it was like, I had spotting that was very random, but it was itchy. And eventually I had to tell Umama, like, but I was so scared that I was going to get into trouble because, like, I must have done something wrong. Yeah. But I know I haven't slept with a boy. But only people who sleep with boys have these things. It was. I think for a couple of days, I sat and I prayed it away. I hoped it would go away. Even telling the doctor was hard. And then he was a male doctor. Yeah. It was just hard to describe. Like, I don't know. It just happened.
So yeah, thrush is quite common in young girls. And the biggest culprit is bubble bath and soap. And wanting to smell fresh down there. So you see it in the early teens when they start noticing their womanhood, and then they start using these fancy soaps down there. So, but it's a common thing, and thrush is easily treatable. The home remedies are not something to try. Yogurt doesn't work. You'd need lots of yogurt to sort that out. But for young girls, when it starts itching, it's okay. Tell a parent, tell someone. It can be easily sorted out with one tablet, and then the itching is gone. But these are some of the things that we see. And unless we teach the young girls before the incident actually happens, it takes away a lot of stress because they literally sit for days stressed about this itch and this white thing that's coming out. They don't know what to do about it. They don't know who to tell. But had you told them about it before, to expect that when you use bubble bath, this is what happens. So don't use it all the time. So that when the itch starts, they can say to you, Mama, there's a problem, or Dada, there's a problem, and you can easily sort it out.
Okay, last question, and then we'll go to Mam Dantile over there. Is it normal for young girls who've now started their periods to miss a period?
Yes, it is. And that's the short question. The long answer, the long answer is, as we develop as young women, our cycle doesn't kick in immediately. It develops as well. And its development can result in the missing of period, and sometimes in having a period more than once in a month. And also those hormonal changes are what is responsible in adolescence that you see all the time. The mood swings, the skin changes, the weight gain. I've spoken about the hair already. And also that fatigue, but sometimes can be very energetic. That's just the up and down of the hormones in the adolescent girl. So yes, it does happen, unless, of course, the young girl is on a pill for whatever reason, then they're not going to see that up and down, but it is normal.
Okay, great. Thank you for that. So just a reminder at home that we are live. Please send through your comments and your questions. We've just learned that gynaes are not just for pregnant, menopausal, or women with the issue of blood. They're for everyone. Mam Dantile, let's come back to you. So you spoke about muscular, skeletal, and I think, and also then helping to do with basically with muscles and my bones. And I want to zone in on the bones. Is it true that men's bones are stronger than women's bones? You're on mute again.
Okay, there was background noise. All right, thank you for reminding me. The strength of the bones. Okay, let's start by saying that men are stronger than women in terms of the physiology and anatomically as well. Physiology meaning that you would find that when you do the races, for example, you get men's race and women's race because men run faster than women because of their oxygen composition in the body. Okay, so when it comes to the bone strength, the bone strength would generally differ from person to person, but generally you'd find that the men have got a stronger bone structure than the women. Okay. Yes.
So is that then, so women then are more likely to develop osteoporosis later on in life than men? Is that the main reason?
I think so. Yes, that would be the main reason why women will develop osteoporosis later in life. But remember, with these things, there's a whole lot of factors, environmental factors that compounds osteoporosis. It's not like a straightforward answer. Dietary requirements also become a factor. Your diet, your work, the type of work that you do, if you don't strengthen your bones, it becomes a factor. So you are not going to be able to attribute it to only one factor, and that I'm a man, therefore I'm good. There's other things that needs to be taken into consideration.
And what is there? I read that there's a time where you stop absorbing calcium easier into your body as you grow, and so we have a period where our bones are strengthening and we're absorbing calcium, whether it's from the food or from around. What is that age where that starts slowing down if it doesn't stop at all?
It usually is around the middle age, when you have stopped growing, right? I know now these days they actually say that people begin middle age is at 60. No, I don't know about that one. There's these social media Mongols who are rewriting science. But once you begin to be in your 40s, then that's where things begin to develop south.
Okay.
Because the aging process is beginning to set in. You cannot grow older anymore. And as you are in your 50s, it actually decreases and decreases and decreases. Okay. So I mean, it's like if you're talking about the spinal health, you find the people that were tall, that they're growing shorter because of the water content that is found in between their spines, that it is lessening. It's no longer the same. So it's not necessarily the bone itself that is, but there is also that sponge that is found in between the spines that is called the discs. And in those discs, that's where the water content gets absorbed. And as you grow older, it gets reduced. So you find that if you were a 1'10" tall, and as you grow older, you reduce you become 1'5" because of the water content. Hence, you find in later stages, you see the elderly people that they are bent and their backs are bent. That's another story for another day.
It's a thing. We literally are growing shorter as we grow older, like we're shrinking.
Yes.
I thought it was a myth. Wait, so our
no, it's not a myth.
Our bones then necessarily getting, I don't know, softer, more brittle?
No. You see, it's not the bones. It's not the bones. It is the. It's a pity. I didn't get to the slides. Between the spines and in between the joints, there are cushions that are there. Especially, let's talk about the spine, your back, that has got the cushion in between the bones, because the bones themselves alone, they don't work. You actually get a combination of the bone. In between the bones, you get a cushion, a sponge-like thing that makes sure that the bones don't friction against each other and soften up and break. So that cushion has got a gel substance that maintains it to be in the height. So that is that gel substance that reduces in size.
Okay, all right, thank you.
It's not the bone itself. Okay. It's not the bone itself. If I had my presentation properly in place, I would be able to demonstrate that actually causes it's not the bones. Otherwise, I mean, the bones, they will break. And if they break, then we can't be able to do a whole lot of things. But it's that gel cushion that is in between the bones, especially of the spine, of the back. So you have it in between. It's like if you imagine the jelly, the good old jelly we used to eat on Sabbath, during Sabbath lunch, the green one and the red one and the yellow one. So that gel, it is the one that reduces inside because the water content reduces as one age. And it's a normal phenomenon. There's nothing we can do about it.
Yeah, okay, no, I get you. And I read somewhere, that's why I was laughing. I read somewhere that people, when we are young, we fall and we break our bones. When we're old, we fall because our bones are breaking. Tiny, you wanted
because
to
they're softer, yeah.
Yeah. I just wanted to add that around the age of 40, after our 40th birthday, we start reaching a decline in our ovarian function as women. So our ovaries are not producing as much hormones as we were in our 20s and our 30s. And because of that, like you correctly said, there's a reduced absorption of calcium into our bones, or there's a reduced deposition of calcium into our bones. So it's also genetic. So some families have got more risk of becoming osteoporotic than others. And then also our lifestyle. So someone who's been gymming for all their life, and I mean healthy gymming. I don't mean gymming with steroids and smoking. I mean proper gymming with a healthy diet, no smoking, no alcohol, because those also have an impact on your bone health. Steroids as well have an impact on your bone health. So if you have a good diet and you're exercising, you're more likely to maintain your bone strength. One of the things we counsel or advise women around menopause to do, so after age 45, is to walk, brisk walking. And because one of the places that women break is your hips. So your hips are the first problem site. The back is always a problem, but the hips as well. So old grannies fall because their hips are broken, or they fall and break their hip. So the what we tell women is that you need to start walking if there are people who are not walking, to try and get some bone strength into those hips.
Great, thank you for that. Ma'am Tati Lelenka, back to you. So when it comes to us women specifically, right, and our need for physiotherapists, one of the things you mentioned, especially with women who've given birth, is then about the pelvic floor and strengthening that, right? How are some of the ways that we do, even if I haven't given birth, right? Because I still need to make sure that my core is proper, is straight. Apart from yoga and Pilates, what are some of the things that you advise women to do to make sure that we strengthen our pelvic floor?
Okay, if we look at problem number one with women without giving birth, if you just walk down the mall or down the streets, you see that they have developed a healthy deposits of fat around their bellies. So they've got these big tummies. So diet then becomes number one, that we have to go back to Eden and make sure that you can eat properly. That you cannot do without eating properly. Number two, you need to make sure that you can strengthen your belly muscles. There's no other way of strengthening your belly muscles, which you call a core, besides doing it. You just have to strengthen your core muscles. How do you do that? Do you need to go to the gym? The answer is no. There are exercises that you can do at home on your floor, because everybody has got a floor at home, or on sitting on a chair. But the floor becomes the best because it's a hard surface that can be able to support your back without compromising the quality of movement that one is able to do. So to answer if there is anything besides yoga, walking, as Tanya has mentioned, yes, it is. That's what you need to do. Also, there's core exercises, your yoga, and the good old exercises that used to be done when we're playing netball and soccer. But then you need to be guided so that the exercises that you do, they ensure that the back is properly supported. Your low back muscles, they are properly supported when you do the exercises, so that you don't injure your low back.
Okay. In fact, let's come to that. Let's talk about the back. What are some of the causes of back pain for women?
High heels.
Hiking.
Wearing those high heels.
High heels?
High heels, yeah. High heels. High heels is one of those, because immediately you wear that high heel, it tilts your back forward, and if your low back is weak and your stomach is weak, the force of gravity pulls that belly forward, and your back is not supporting. All the back muscles try to balance, because you need to have a balance between the strength of the muscles of the stomach and the strength of the muscles of the back. So your back and your stomach muscles need to keep you in a straight posture. If you have seen people who wear high heels, they try to walk up straight. Others, in the difficulty of keeping up, they bend the knees. So it keeps the alignment, it just messes up the alignment of the body. So those high heels do definitely cause low back pain in the long run, depending how long you wear them and where you wear them and how you wear them. That's number one. Number two, it is to how we sit, the postures that we adopt. When we sit in front of the computer, when we sit watching TV on our couches, if we slouch and overstretch the back, those positions predisposes the low back to undue strain. You either strain the muscle or strain the ligaments that are supposed to be supporting the back, and that leads to back pain. Another one, it is how we do our chores, right? Chores meaning if you're doing your good old, you're doing your hand washing and you're leaning on the bath and you wash your washing on the bath by hand if you don't have a washing machine, and as you take out the laundry from the bath, you bend. You are in a bent position and you keep on twisting, you keep on rotating. And you keep on doing that. It's not only a once-off activity. When it is a repeated activity, it causes the low back pain. So it's a repetition actually of undue movements, undue strain to the low back that causes the back pain. So those positions, you find that sometimes even the office workers, when you're sitting in your office, whether it's at home or in the real office, you find that the telephone is on your left-hand side, and the laptop, the screen is sitting in an improper position, and you constantly have to twist. Or if you don't have a proper supporting chair that supports your back, more often than not, you find that you have got a chair in the office that supports your back, but nobody ever supports the back. You're always sitting forward. And because we've got weak abdominal muscles or back muscles, or the combination, it does not support your back. And you end up having back pain because the muscle becomes tired. Why would the muscles become tired? The muscles become tired because they've got elastic properties. And the back, remember another thing, that it is the most flexible part of the body, one of the most flexible parts of the body after the neck, because you are able to bend, so it allows you to bend. So the muscles are designed to allow us to bend and allow us to maintain a position, not to move. So they serve a stability and a mobility function. So the balance between the two needs to be maintained at all times. So it's a balancing act. Another common cause of back pain, it is that accident, those bumper bashing. You have a small bumper bashing and nothing happens to your car, nothing happens to anything, and your back becomes so painful. Last year in November, I was bumper bashed by a car, not once but twice, and it was the car, because it has got a tow bar. There was nothing really seriously damaged. But by the end of the day, we could see the dents, that, okay, here is a dent there, here's a dent there. The following day, my low back was so painful. It was absolutely so painful. So we're just saying that sometimes there's no immediate pain, but the following day you begin to feel the pain.
What causes back pain during periods? Because I don't think that's unique to me. There's times where just the back, even before the period starts, the back is already pronouncing, but this is going to be one of those months. So what's the link there?
Tiny can answer that one.
Okay. Yes, Doc.
So it's the womb. It's the womb.
Yeah.
Okay, so when you're about to have a period, there are chemicals that go into the lining of the womb. Mm-hmm. And these chemicals are going to break down the lining of the womb. And the chemicals are the same ones that when you have a cut, would seal off that cut. We call them prostaglandins. They cause swelling, they cause fluid to go into that area. In the womb, they do the same thing. And hence the feeling of heaviness, the feeling of bloating, and the back pain. So, yes, it's normal. However, it's usually pain that goes away either just before the period starts or when the period starts. If the pain persists during the period and even gets worse as you're bleeding, then it tells you that there's also something pathological going on, right? So most people will get the pain, lower back and lower abdominal pain, and some describe it going into the knees and under their feet. Those things are normal. And once the bleeding starts, it usually goes away. People have their own remedies about what works for them. Some are hot baths, some it's hot water bottle, some it's going for a jog. Everyone has their own trick on what works for them. And usually the young girls struggle with that because for them it's just starting. And then the women who are going into menopause also are struggling because it does change. So at the extremes of reproductive life, so when you're starting your reproductive life and when you're ending the reproductive life, it does become more unpredictable what is going to happen to your pains that are associated with your period. But lower back pain when you're about to have your period, number one.
Ish. Yeah. So just a reminder at home that we are taking questions, and I've got some questions for you, Tiny, here from a young lady, a
Can
teenager.
I just say something before you go to the questions?
Yes.
There is a verse in the Bible. Genesis 3, ne? After Eve has done the undoable, we are promised we shall bear them in pain.
In pain.
So the pain doesn't only come with labor pains. We have that pain
Hey, Siyambulelo
every
Efa.
single month.
I think Efa likes others more than others because others suffer more than others. Okay. This is from a young teenager who says 3 questions, but I'll read them all together. She says, what do the different colors of the blood mean? Like sometimes it's light red and then it can get very dark red. And then actually I'm adding now, sometimes it gets even clotty, and then sometimes it's almost brown, like move to brown. So what's the significance of that? And then another one is it normal to have your period twice a month? And again, in that early productivity age. And so when do you need to know, how do you know when you need to actually consult a doctor about your period?
Okay, so I've already answered the second question that sometimes in the young woman's life, you can get your period twice a month. And that's because you don't have a set-in cycle. It's still developing. I'm going to try to be as simplistic as I can. So the menstrual cycle, it's not something that only happens in the womb. It starts in the brain, goes to the ovary, and then goes to the womb. So as you develop from childhood, no, I lie. When you're in your mother's womb as a girl, you have your eggs set out. The eggs are there. So if your mother gave you 500,000, if your mother gave you 5, that's it. It's set while you're in your mother's womb, right? Then you grow and you develop. And as the little girl's brain grows, so the sexual hormones start developing as well. And the rhythm changes as you grow older. Initially, there is no rhythm, but as you grow older, there is then a rhythm. When the rhythm is set in, and this is usually between 19 and 21 age group, that's when young girls become able to predict their period because then they have a set cycle. So from 12, when they start their period, to the age of 19, they're like all over the place. And that is why their period volume, so the amount that is coming out, will not be the same every month, or every time, rather. The date will not be the same every time. The consistency of the blood will not be the same every time. Also the symptoms, so the PMS symptoms won't be the same. So you remember I said at the beginning that young girls have got also erratic hormones. The erratic hormones cause the erratic behavior. You see it in their behavior. A lot is happening. And I think as parents, I'm a young parent, so I can't talk for the parents with older kids. But as parents, we're not empowered to deal with the erratic hormones. And we say, ane cheeky, usile. Une cheeky, it's true. But most girls don't see their behavior. Uguti, I'm actually out of line. Because the hormones are driving them insane. It's the same even on the other side. Perimenopause. And for those who are married, this is when your marriage problems start. They don't see it, but it's happening, and it's the up and down of the hormones. So the blood that is pink and brown and bright red, it's the change in the hormones. It's a reflection of your hormones at that time. The clots are a different issue. You want me to talk about the clots? So, clots are usually a sign that your bleeding is excessive. Okay? And once you start seeing clots, you then have to look backwards and see what else is happening along with the clots. Okay, am I cramping more than I used to before or during my period? Clots may be a sign of fibroids. Clots may be a sign of an underlying infection. Clots may be, depending on your age, a sign of cancer inside the womb. Okay, so clots are special. They're not going to be the same as the consistency or the color of the blood. It's a different mechanism. Okay, but also we are in 2021. Everyone is taking aspirin because everyone is preventing COVID. People are taking aspirin like it's Smarties. Aspirin does make your blood thin, so it is going to make your bleeding a little bit more than usual. So people also have just come out of hospital and have recovered from COVID and were getting blood thinners. They might, in the month after, or in that cycle, might get a more excessive bleed than normal, okay? People who are taking aspirin because they've just recovered from a stroke or a heart attack, whatever, but they're taking some blood thinner, they might find uguti their period, the blood that's coming out, is different to what they are used to. And that's when you need to consult so that either your dose needs to be adjusted or maybe you just don't need it anymore.
Wow, that is so interesting. So I think what I'm picking up from you is that if I'm a mother of a young girl, I just need to have a gynae on demand. Like, I need a gynae who will know my child and help my child understand.
No. Just remember what you were like when you were that age. You don't really need a gynae on speed dial. But also having good relationships with other mothers of your daughter's peers is going to help. Because some things girls pick up from their friends, right? And they behave because they're expecting something to happen. And because Oluetu carries a hot water bottle when she's on periods, why am I not carrying a hot water bottle? Then she starts picking up a hot water bottle and she actually doesn't need it. Then, Shamisha's mom gets her Lindt chocolate when she's on her periods and buys her, I don't know, whatever. So why can't I do that? But you don't have her problem. So each mother needs to know their daughter's problem and address that problem. It's not necessarily going to need a gynecologist. And allow me to digress and use an example. Mom, and this is an actual case that I've seen. Mom has got her own psychological issues. There are problems at home. Mom is perimenopausal. Daughter is 16, daughter is going through her own issues of being a 16-year-old, but reports some pain during her period. Young girl reports pain this month and the other month. Some days in the middle of the night screams that she's got pain. Mommy and daddy rush her to casualty. 1 time, 2 times, 5 times. She ends up on a theater table. She's operated. There's nothing to find. She continues complaining about the pain, ends up with another operation. There's still nothing to find. Ends up losing an ovary because there's nothing to find. But the problem, it's not the period pain. The problem are the issues at home. So I don't blame the mother. I blame the home situation. I don't blame the gynae. I blame the home situation. Because had we as parents managed the home situation, this child wouldn't cry about pain because she's crying out for attention. And then she would have prevented the multiple operations looking for nothing when what she needed was the parents to be okay. Because some children do that, and a gynae is not going to fix that problem. That needs a psychologist, a family physician, a family psychologist, maybe umfundisi, and some prayers. But a gynecologist is not going to fix the problem. And that's why I'm saying, you don't need a gynae on standby. You need to know your daughter.
Yeah, hey.
Can I come in here?
Yes, ma'am.
And say, can I come in and say, those are the children or the girls that I get to see at the psychiatric hospital because they present with pain. And because physio, we do pain management as well. So when they are in the psychiatric hospital admitted for such family problems that Heidi has highlighted, they end up being thrown at physio for me to manage the pain. And you see most of these people, not even girls only, generally women, you'd find them with multiple operations, a back operation, a shoulder operation, a leg operation, an abdominal operation. They've got all sorts of operations. Then you know that the problem is necessary and they find nothing. And they put on these gadgets. There's some little gadgets that they get put in their skin so that when they've got pain, they can press and it reduces the pain. They end up with physio. I had another one even yesterday. She has got this gadget and it's not working and always got a little something like a little cell phone. She just carries it and she puts it around that battery that is inserted and she reduces the pulse. I don't know, but she still ends up in physio because the pain management does not work. So I agree that the homes needs to be managed differently. Homeschooling, we learned this morning during our Sabbath school presentation from the families that homeschooling is not for the kids must get school at home. It is for parents as well. The mother teaches the father teaches the mother, and the parents teaches the children. So everybody gets taught in a homeschooling environment so that they can actually be able to coordinate the home environment in a godly manner. Thank you.
Thank you. Something Tiny said that made me chuckle a bit there when you said the mother is menopausal or perimenopausal. The daughter is 16 and going through her own. I'm like, the poor dad is surrounded by all of this. And if they're not educated, they will, probably, as you said, some of the marital problems will come there because they'll be like, this is not what I signed up for. Tiny, is it true that women who live together for extended periods end up synchronizing their cycle?
It's true.
What causes that? That's so interesting.
We end up cycling together when we spend time together, and it's just the way the hormones then synchronize themselves.
Sure, we are indeed fearfully and wonderfully made, because honestly, these things, there's nothing beyond that. There must be like a creative, interesting creator who's put it out there. Ma'am Dantela, I want to come back to you. You started talking about the back pain. What are other manifestations of back problems? Is it just the pain on my back, or does it manifest in other symptoms as well?
Yes, it does. What we have found that then you get a back pain that gets chronic. If it has been happening over a period of time, more than 3 months, you've got this pain. It ends up having symptoms where you find most people would come in and say that, oh, I'm even scared to tell you what I have. I've got pain in my butt, or I get numbness in my butt, or pins and needles in my butt, or the pain shoots down the leg to the toes, depending what type of what toe, the big toe or the small toe, then you know it's what level is the back pain. Yes, you do get the manifestation of back pain, causing the leg to be numb, that you cannot even walk because there is a side of the leg that is numb. And that would be caused by the disc that has, or a severe muscle spasm that would have squeezed a nerve that supplies that particular area. And in severe cases, you actually find that people lose their sense of feeling the urine. It causes incontinence, that they cannot feel that the urine is coming out. I mean, those are the very, very severe cases of low back pain when there's disease manifestation. Yes, you do.
And I just went blank. You said something that I wanted to take on to, sorry, there, and then I just went blank. Okay, no. Coming back to the psychosocial issues that I'm dealing with at home, right? The pain that I'm feeling, like that back pain that I'm feeling, is it real pain? Like, because I don't want to say that young girl is pretending and imagining it. Am I really in pain, even though it is psychosomatic? Am I actually in pain?
Psychosomatic pain is real for the person that is feeling the pain. And it is very common in people who are highly stressed to have back pain. And there are also some medication that have got side effects that causes back pain, right? So it is. Sometimes you get somebody who comes with back pain and they said, I must manage that, and I cannot pick up the clinical symptoms that are in line with the back pain. Then you know that is psychosomatic. Others, they tell you that their back pain is so much that they are not able to walk. And it will be because it's psychosomatic. So as you do your therapy, you need to be able to access their psyche and be able to give them confidence that they are able to walk again. So the version of to answer your question, yes, you find that the pain is real. Sometimes it is just psychosomatic. It's only clinically, because I do know that they do all sorts of tests to test whether you get taken to X-ray to see if there's any problem with the bones. You get taken to the MRI scan. They do an ultrasound scan. You get taken to the neurosurgeon, to orthopedic surgeon, all sorts of surgeons, only to find that the problem is emotional. It's at home. It's absolutely at home and nowhere else. I had a young girl the other day, and she had back pain, and she says to me, her name is her name I mentioned is not what's written on the file. She told me that no, that's not my name. My name is so and so because I'm transgender, and she's 17. And you now think this back pain I'm going to be dealing with here, I need a different mindset altogether. You say a little prayer and continue with the assessment.
Hey, wow, yeah, I think you see all kinds. Just psychosomatic, for those of you at home who are lay people like me, is basically the physical manifestation of an emotional challenge. So I'm having psychological issues, but it manifests physically. Tiny, let me bring it back to you. Is there such a thing as a biological clock for us women? Is that thing real, or is it just Disney that's promoting that?
I think the difficulty I have in answering that question is what you mean by biological clock. So, some people understand a biological clock as in I'm 40, I have no children, I've run out of time. But the real biological clock is our body responses to day-night rhythm and releases hormones based on whether it's day and night to manage the well-being of our body so that you know that at nighttime you sleep, in daytime you're awake. In the daytime you have this much cortisol to maintain your blood pressure, to maintain your awakeness. You have this much of this hormone to allow for growth, for appetite, for whatnot. Whereas at night, those are going to switch off because you're sleeping. So when you ask me about a biological clock, I want to know, what are you really asking me about? Because if it's the first one, as women, I've said this already, in your mother's womb, you have the number of eggs you are going to have. So the number of eggs I have was determined in my mother's womb. The number of eggs that Mihlali has, my daughter, was determined in my womb, right? Mihlali has a set number of eggs, right? I have my set number. As I don't know when. My mom is 66. She's reached the end of her reproductive life a while ago, right? So, yes, there is a time when things start and they end for a woman. Men, totally different story.
As we've seen, as we've noted. No, but isn't there such a thing as, okay, is it true that at certain ages, the quality of your eggs becomes, it deteriorates, and therefore you're encouraged to have kids at a younger age than at an older age because of that?
Okay, so what you've said is true. Okay, so the ideal age to have children is in the 20s and 30s, right? When you get to 37, we're already calling you advanced maternal age because the risks for that woman are different to a 30-year-old.
They call it a geriatric pregnancy.
No, it's advanced maternal age.
I prefer that one.
I have a different definition of what a geriatric pregnancy is, and I'll
Sarah
get to it.
in the Bible, that's geriatric pregnancy.
Correct. So what happens is as we grow older as women, those eggs that we have, so they multiply every month, and we pop 1 or 2 every month, depending on how you're programmed, okay? So you pop 1 or 2 every month, some people 4, some people 3. Most women who are trying to fall pregnant will only fertilize 1 when God wills. If you want me to explain what I mean by when God wills, I will. But that's what we do. But we're taking from that supply that was determined in your mother's womb. But the division process that happens is where things can go wrong. There is an error checking mechanism in all our bodies to make sure that when the cells divide, the ones that have got errors are chucked away, and the ones that don't have errors are the ones that are meant to make a baby, right? But as you know, sin did the things, and now even eggs that have errors can be fertilized, and then we have abnormal babies, okay? And that's how we have abnormal babies, that there was an error in the division of the chromosomes when the cells were dividing, and it met the sperm, and sometimes it can be the other way. The egg was good, but the sperm had an error. They combine, you have an abnormal baby. So as we grow older as women, these errors happen more rapidly. They're more prone to happen. But also what happens, the second thing that happens when you're older, is that you ovulate less often. So after the age of 37, you don't ovulate every month. You may see a period every month, but it's not preceded by an egg popping every month. And that's nature. I'm sure back in the days when women were still living to the age of 600, the ovulation process was different. But with our deterioration of our bodies, that's how it is now. We know that women around the age of 37 don't ovulate as often as they should, and therefore it becomes, one, difficult to fall pregnant, but also the errors are much more often than in a 27-year-old or a 30-year-old.
Is there such a thing as a hostile womb? And if it is, what is that?
I'm suspecting someone heard that because they were having miscarriages or struggling to fall pregnant.
Yeah.
Yeah, so these are words that, in my opinion, fly out in error. Things happen in a woman's body that don't allow her to carry a pregnancy, either at all or they carry a pregnancy up to a point. And there are remedies for most things. I'm not saying all. So about a third of women who have a fertility problem, 1/3, it can be rectified. Another third, it can be rectified with medication and operations and some medical intervention. And then the other third, no matter what you do, you can even go to in vitro fertilization, where they take the egg and the sperm and mix it outside of the body and re-implant it in that woman. It just won't take. And it can either be something inside the woman's womb, or it can be something within the pregnancy that causes that. So the pregnancy is not developing because there's an abnormality within it. And usually by that time, if you have gone for infertility treatment, and this has happened once or twice, by then your fertility specialist would have said, let's go and examine the parents' chromosomes and see that maybe there's an abnormality in the parents' chromosomes, and that's why this couple and their genetic product is not able to sit in this woman's belly or woman's uterus. So there are those things, and it's a complicated and a quite advanced part of gynecology, which I'm not a subspec of fertility. There are people who are subspecialists in fertility treatment. But though it's once you get to a point where the woman is being told you have a hostile womb, it's usually because there are fertility issues, and it is being pinned on the woman's uterus, and it's not always the point. We do need to look at both parents and the product that comes from both parents' genes.
Oh, okay, quite interesting. Now, say I'm a young woman, not yet ready to have a child. Could I still go and get my fertility assessed in case there's a problem that could come later on when I'm ready to have a child? So is there, or do I only start seeing a fertility specialist when I'm trying to have a baby and it's not happening?
So my advice is leave it alone. If you're not planning to have a baby, why are you looking? So leave it alone. When the time comes and you're ready to have a baby, and this is going to depend on your age. If you're young, so between the ages of 20 and 35, no, let me say 20 to 30, and I'll justify that just now. If you're between the ages of 25 to 30, you've tried, for 2 years and nothing has happened, like not even a miscarriage has happened, then you need to worry because you've tried for 2 years and nothing has happened. Then by all means, go to your gynecologist, have them look. If there's something there that they can't deal with, they will then refer you to a fertility specialist. Between the ages 25 to 30, we don't often wait 2 years. If a woman has tried for a year and she hasn't even had a miscarriage, so she hasn't fallen pregnant and had a miscarriage, then we do worry, okay? But we also look at what other medical problems that lady might have. Because around the ages of 30, 25, 30, that's when people start picking up other problems, autoimmune diseases, and many other things that can affect your fertility. Your weight is going to play into, it's going to contribute towards that. And then between the ages of 30 to 35, you've been trying for 6 months, and there hasn't even been one scare. Then we're like, okay, maybe we have to look. But again, we look at how your period is going, so the cyclicity of your period. We look at how much pain you have during your period. And the pain, because of fibroids, endometriosis, pelvic inflammatory disease, because the assumption is by the time you're over 30, you may have had more than one sexual partner. So you may have been at risk of acquiring a sexually transmitted infection that may have damaged something inside, okay? That's the assumption we make. It's not always the truth, okay? Then there's something called Polycystic Ovarian syndrome. You can Google that when you have time. That causes you to not ovulate every month. Sometimes we see it by weight gain, skin changes, and a whole lot of other things. But it can also cause you not to fall pregnant. So there are many reasons why a woman may not fall pregnant. But when you're not trying to fall pregnant, don't look.
So I've got a few questions here, and I need to move on. Oh my word, we're running out of time. We haven't even touched on pregnancy. But I think just the last few eggs, so this may cover it. So what you're saying is somebody says, is there a way of checking how many eggs they actually have? Is there a way of knowing how many eggs you actually have?
There is a test that we do, along with a scan. The test is called an AMH, anti-Malarian hormone. And then we do a scan and see how many follicles are in your ovary. The follicles tell us how your ovaries function. It's not a what's the word I'm looking for? It's not a direct science. Because you get good numbers, that doesn't necessarily mean things will go well for you, but it's a guide.
Okay, so let's bring it to pregnancy, right? What are some uncommon pregnancy, I want to say side effects? What causes that nose and those thick lips that some women get? What is it? Yeah, what are some of the things that you see that are a result of pregnancy? It's all hormones.
Hormones. Hormones. But then there's some women that carry it so well. They can be pregnant and their face looks exactly the same way it was when they were not pregnant. Some of it is genetic makeup. Like if the women in your family generally carry well, chances are you probably will. Not definitely, but you probably will. Most of the things that we see in pregnant women, it's all hormonal, and it's gonna go away. And most of it goes away.
I was gonna ask that. So does it though? Because you typically find a lot of women, they do change after having babies. Maybe, some of that weight gain doesn't go back completely, but there's also some noticeable changes that they pick up just in their system. So, for example, we have a question here from one of on the audience who says, after the third child, she says, I closed the factory. And then she says, I started experiencing very heavy periods and back pains after that. And that before that, her period was not that heavy. So, do you ever go back to what you were like before your period, before your baby, before your pregnancy?
Look, some things do go back, some don't. And that's the influence of hormones, right? So generally, like your menstrual cycle might go back, but it's going to be influenced by the weight gain and whether you shed it off or not. It's going to be influenced by the type of contraception you choose. It's going to be influenced by things that may happen in your womb that you are aware or unaware about. So also things change as you age. And you really don't have control over that except to have it checked out and see what's happening. After 3 babies and then having menstrual problems, we can't really blame the tying of the tubes. But the blood vessel that feeds the tube, in some women, not all, it also has a branch that feeds the ovary. So if I do the sterilization very well and I tie very well, I might block off some of the blood supply to that ovary. And the ovary takes messages from the brain that are going to determine my cycle. So if I've messed up with the blood supply around your ovary, then yes, for a time, your period might become abnormal, but there are many blood vessels to the ovary, so it usually recuperates over time.
Ma'am Tantile, let's come to you as we start, winding down. So one of the things you hear a lot about when it comes to especially bone health is vitamin D, right? And we assume because, you just stand out in the sun and you'll get vitamin D. But more and more now we're hearing a lot of people talk, or a lot of even doctors suggesting that people go on vitamin D supplements. So can you talk us through, is it just as simple as me standing out in the sun that I get vitamin D? And if so, why is it that people in Africa, where there's so much sun, still struggle with vitamin D deficiency?
Okay. The vitamin D, yes, it's true, it comes from the sun. There is the issue of absorbency, whether your body has got the ability to absorb the vitamins or not. It then becomes an issue that needs to be looked into to check whether you are able to do that. But to stand in the sun does really help. I have not looked into the research that says in Africa people they've got more. I mean, the global study that would compare which countries have got people who've got more vitamin D deficiency or not. I'm not one of those people that are very big on supplements recommendation. I prefer that you get it not from the pill, but from the food and from the sun. The combination cannot fail you. But if there is a problem in your body that makes you not to be able to absorb, have got a problem with absorbing the vitamin D, causing you to have insufficient vitamins, then you would actually want to go and have that checked out by your GP. But otherwise, get it from the food, get it from the sun, do exercises. You should actually have a good bone health with regular exercises, not only when it is going to be summer and there's a rush to get exercises. You do it regularly and you should be good to go.
And I have another question for you, which is a bit PG, but hey, we need to know. Is it true that people who are, when you are not that, is it true that you get a prolapse of your, I don't know if it's the womb or the whole pelvic area, if you're not sexually active or not regularly sexually active, that you can get a prolapse somehow? And this can go to either of you doctors. Is there such a thing?
They lie.
Hey, Bo.
No.
It's not true. It's not true. It's not true. It's not true. So you do get prolapse, and okay, so what predisposes to prolapse? Pregnancy. But there are women who've never been pregnant who get prolapse, and that's because of the weak connective tissue. Connective tissue is cartilage and ligaments. So again, that runs in families. And black people have different genetic cartilage makeup to white people. It doesn't mean we don't get prolapse. We're less likely to get prolapse than white people do. They get more, but pregnancy, and it's pregnancy, it's not normal birth. Because some people think it's the pushing of the baby that gives you prolapse. It's the pregnancy itself. Because when you're pregnant, the whole pelvic floor is carrying that womb and that baby. So pregnant women who become pregnant are more prone to get pelvic floor. And the more pregnancies you have, the more you have used the pelvic floor. Okay? So one of the things when we're taking a history from someone who's had prolapse is how many babies have you had, how many have you delivered normally, and how many were you assisted? Because when we assist in taking the baby out, we may sometimes cause damage to the when I say we, I mean anyone who helps with the delivery, not just obstetricians and gynecologists. So pregnancy,
so
genetic
it's not from
makeup.
lack of action.
No, they lie.
No, it
Well,
can't be.
that was a nice prognosis, though. You can say, well, the doctor ordered it, so.
They lie.
Okay, we've got 10 minutes, so I need to now be selective about the questions that I actually have. Sizola, what is the impact of menopause on my bones, and especially on my back there? And I think we've started touching on this, but if we can go into this, what is the impact of menopause on my movements and my physio?
The impact of menopause is that if the women that are over 40 years, they will tell you that no matter how much, whether they eat a thin slice of apple and one raisin, they gain weight. Because the body has a slowdown in processing anything, the metabolism just slow down because of aging process. So the impact of menopause is that you get slowdown of how the body functions, right? So when you exercise, you are trying to maintain any activity to try and get the juices moving, you try and get the bones strengthened, you can try and get the muscles strengthening as well, the joint health. So you try and get everything that needs to get going, right? Because menopause is going to influence your whole body function. So the impact of menopause, it slows down how you function. So when you do exercises, you are accelerating your functioning and maintaining it and improving it, and make sure that you don't deteriorate faster than you would otherwise. Thank you.
Wow, okay, thank you. Tanya, I've got some rapid questions, yes or no questions, in terms of now virginal health, right? So you already spoke about bubble bath, that minimize bubble bath because it can lead to thrush. Here's some questions in yes or no. Shaving, waxing, removing all the pubic hair, yes, no?
It's not a yes/no question.
Does it have an impact, or is it just cosmetic? Is it just
cosmetic.
aesthetic?
So it's cosmetic, but in other, I want to use the right word. Kwabanye abantu, it's a religious, I want to remain clean thing. And you mentioned shaving. What else? Waxing.
But shaving, waxing. So anything to remove pubic hair, really.
The reason it's not a yes/no question. Shaving has its problems. If you have curly hair, it's going to get stuck underneath. You're going to get bumps. You're going to get pustules. Okay? Waxing is one of the better ones in terms of cleaning down there. because they're just plucking the hair out, right? But again, if you're a person who already has got curly hair, rather cut the hair short, not all the way under the skin, because it's going to get stuck, boil. The creams are a problem. They burn. People have allergies to them. They can cause thrush.
Okay, let's come to underwear. Thongs, G-strings, yes, no?
Whatever rocks your boat, as long as it doesn't cause irritation, it fits well and fits well. Yeah.
Phew, amen. So I don't have to wear cotton bloomers.
If that's what rocks your boat,
Tight
Go
jeans,
ahead.
leggings, yes, no?
yeah, tight jeans are a problem. It's like the shoe issue. How long are you wearing it? So if you're going out and you're comfortable, you can breathe and sit and eat and be okay with friends. For that short while, then it's fine. But if it's a habitual, everyday thing, it's going to cause problems. Like the underwear, it's going to cause abrasions. You're going to have discharges and itching and, yeah.
Going commando, so no underwear at all. Is that better for me?
That's fine. I mean, if that's what you want to do.
Peeing immediately after sex reduces
Is
the chances
recommended.
of... Is recommended.
It's recommended.
Nivile, kene. And then you started on the yogurt, and I wanted to go to that. So eating yogurt, pineapple, cranberry juice, eating it, not inserting it, but eating it. Does that help with my, urinary tract? For example, cranberries, they say it's good for
So
urinary tract.
cranberry, they say, is good for eliminating or reducing the risk of bladder infections. Okay? But when you've got a bladder infection, it's not going to cure it. You're going to need to, it's going to need to be treated. In the same way that if you've got thrush, taking in the yogurt, it's not going to treat it. You need to get the medication to treat it, and then you can carry on eating your yogurt.
But could I eat it preventatively? So could it minimize?
No.
No.
Because remember, so thrush is caused by an imbalance in the pH in the vagina. The vagina, always acidic. You will see it in your underwear, always has a stain. Whether you like it or not, the only way to avoid that stain is to wear panty liners on your underwear. That's the acid, okay? Soap, alkaline, okay? Even the ones that say we are pH balanced, they're alkaline. It's soap. Soap is soap. So now, if you move away from the acidic environment and go into the alkaline, you get an overgrowth of the bacteria that is there, and that's what causes thrush.
Does pineapple help to make me smell nicer? Eating pineapple.
Skip that one.
And then, again, yes or no, and I don't know if you alluded to this, can I pick up UTIs from toilets, from public toilets? No.
No.
Really?
So now,
No.
what happens is women go to a public toilet, they get scared with, it's looking a bit crusty. And then they get home and they wash because they sat on a crusty toilet. And then they give themselves thrush. Or they give themselves bacterial vaginosis. Bacterial vaginosis, same thing. You mess up the pH, there's an overgrowth of the bacteria that was already sitting in your vagina. You get this watery discharge that smells like fish. And then that's bacterial vaginosis. Toilets that are not clean are a problem. And we teach people to wipe the toilet before you sit, but also when you wipe yourself, front to back.
Okay, here's another yes or no for you, and then we'll close off. No, actually, there's two of them. Are there some women who are allergic to condoms? Is that a thing?
Yes, they are. So there are women who are allergic to latex in the condom. Then they must use plastic. They are
Plastic condoms, not plastic.
Plastic condoms.
Yes,
So
please.
there are condoms specifically made for people who are allergic to latex. It's a long name, it's polyury something, the name of the product that is used for that condom. How do they know they've got an allergy? So after they've had intercourse with a latex condom, they get itching, a discharge, and some discomfort down there and burning when they pass urine.
Okay. And then last thing, I read somewhere that also some toilet papers in this article specifically said 1-ply toilet paper, because it crumbles and it breaks off, some particles can go up or remain up, so it's actually not good for you.
I'm going to answer that question this way. Because, I mean, I think all toilet paper can crumble, whether it's 1-ply or 2-ply or 3-ply. Depends on how you use it. The vagina has no door. So even when you're sitting in your bath, the water that may have soap and whatever goodies you've put in there can go in there. The vagina has no door. It's just two walls that collapse. So whatever you are putting on your genitals, you need to be careful how you use it. So like I said before, you wipe from front to back. Okay, and that's to avoid anything going in. But also the tendency with women who get problems is that it's either my nails are too long or I'm wiping too hard. And then I sort of scratch the skin and make things dry. And that's when things become a problem. It's me. It's the way I wiped or how my nails are when I was wiping. So front to back, gently dab. All you want is the water not to mess up everything. That's all you want. It's not every time you're going to a toilet, it's a cleaning ritual. You're just keeping yourself dry.
I like that. I mean, it's obvious, though, but I'd never thought of it that way, that the vagina has no door. So anything can go out, but also anything can come out.
Yes.
What's gone up will come out because there's no door.
And there's nowhere else to go.
Wow. Ma'am Dantile, let me come to you. Any last comments or thoughts or things that you'd like to share with our listeners out there on anything that we've covered today, really? Just your parting thoughts before we finish off.
Yes, I'd like to encourage us to keep our backs very strong, because once the back is damaged, you can't replace it. And how do you do that? Make sure that your tummy is nice and flat by keeping up those stomach exercises. Don't do excessive stuff in the gym. We've seen people that in the process of trying to get their stomachs nice and flat, they overdo it and they try to lift weights and do those machines where you sit and do press-ups and they press 60 kilograms at a go, and 2 kilograms really can do as effective a job as the 60 kilograms that can damage your back. And also when you do lifting is another one. I didn't mention that when we lift those plastics, when we have done our grocery shopping at the different shopping stores, we need to ensure that we can balance the plastics as we lift or taking them into the boot. You don't take 5 at a go, and you don't twist whilst you're carrying a heavy object. So my parting shot is that let us keep moving, let us exercise, and stick to the health message, practice it, keep healthy. And remember the verse, John 3, verse 1 to 2, to say, dear friend, I pray that you may enjoy good health and that all may go well with you. God bless.
Thank you so much. Sis Tiny, thank you so much from your side as well. Any last minute word you want to share with our people out there?
So women's health is basically about the well-being of the woman, both physically and emotionally. Unfortunately, when we talk about these things, we compartmentalize them. But whatever is happening in my head or in my heart is going to affect the rest of my body. If I am upset, if I feel rejected, if I feel unsafe, it's going to manifest in some way in my body, whether by weight gain, whether by pain. And I think as women, because, and this is my opinion, I've got no scientific evidence for it, because we as women are more in touch with our emotions than most men, not all men, most men, we should be kinder to each other as sisters, because we know what we go through each month because of Eve, ne? Because of Eve. We know what we go through each month, and we know how it affects us, and we should be kinder to each other about the changes in our body. When kids become adolescents, it's a storm. When women become older women going through menopause, it's a storm. And the others in between are having other type of storms that they are dealing with. But we all need to be carrying each other through the different phases. The ones that are ahead to help the ones that are behind, and teaching the ones that are behind so that they know what to expect in the future. I've learned a lot from my mother because she's shared her experience with me. I saw her in her 40s. I saw her going through menopause. I saw what her life was like after menopause. And being a gynecologist, that helped me being a gynecologist. But also it helped me not only with the patients, but with the women that I call my friends.
Awesome. Thank you so much. What a wonderful, discussion we've had. And I just want to finish off again by reading this verse, because really, if anything, this afternoon session has been about that. So it's Psalms 139 from verse 13, and it says, "For you formed my inward parts, you covered me in my mother's womb. I will praise you, for I am fearfully and wonderfully made. Marvelous are your works, and that my soul knows very well." If ever you needed any proof that God really is serious about you and you as an individual, these are some of the things. So thank you so much to my special guests. We really appreciate it. Time is always an enemy. And to everyone who was watching as well, we appreciate you. Appreciate the comments. Keep the conversation going. Until next time, from me, Tandi Balfour, Mazanetol.
Thank you. Thank you for the invite.
Zonke izono zixolele zwani izwi lika Yesu.